Hello, and thank you for joining us once again. And I'm going to talk about infectious diseases in this section. This is in Chapter 2, Part 2. And infectious diseases is a medical condition caused by an organism within the body. And we all know certain infectious diseases that are out there, like HIV, hepatitis, and stuff. And what we're going to talk about is how they can be spread and how we can protect ourselves from these diseases. So first off, communicable diseases can be spread from person to person or from one species to another. An example of a person-to-person spread would be HIV. Could be the flu, the common cold, and so on. From species to another would be something like rabies, or even the bird flu, swine flu, and stuff that comes about. To minimize our risk of infections, number one, one of the most important things, not the most important thing, but one of them is immunizations, being up to date on your immunizations, having your flu shot every year, and so on. I cannot stress now how some of the older diseases are starting to make a comeback because we're not following up with immunizations like we should. Protective techniques, we do this by utilizing our gloves and body substance isolation and so on, and we need to make sure we practice this on a regular basis. And also, not only wearing our protective stuff, is we also have to have good hygiene, hand washing and stuff. Hand washing is the best way to prevent the transmission of diseases, and we need to make sure that we do this in between all our patients. And if we don't have the ability to do it, we should use some type of alcohol-based waterless hand solution. And most ambulances now and the hospitals now have this almost everywhere. Another thing is keeping our environment clean by washing the ambulance on a regular basis, by cleaning the stretcher and the seats and everything in between calls is very important. So whenever we utilize protective measures to protect ourselves and our patients, the risk to us as a provider is very negligible. So proper cleaning and disinfecting of the ambulance and equipment will help prevent transfer of illnesses between patients. That's what I was just saying before, that we have to make sure that we clean our equipment, make sure our equipment is clean, and things that we don't think about is like the pulse oximeter, the finger probe for it. It can get pretty nasty. It needs to be cleaned out in between each patient contact. Our blood pressure cuffs and stethoscopes, we need to clean all these things. And the stethoscopes, just think about it. If you're using the stethoscope that's been on the truck all day, you don't know, you stick that in your ears, you could be, transmitting diseases and illnesses and stuff like that. So we need to make sure that we clean everything appropriately on a daily basis, and if it's disposable, we can get rid of it. One thing we need to do is inform providers who may come into contact with patients of potential risk. If you know your patient has MRSA, then let's make sure that everybody knows that they have MRSA. But being discreet is very important. You don't need to scream it out in front of the entire ER staff or on other patients in the trauma bays and stuff like that. Take the nurse or whoever is going to be taking care of that patient to the side and just let them know. And make sure you document it in writing as well, so that there's a legal trail that you did make sure that you informed the staff. And if it's in writing, then you have some information there for people who may not have been there for when you were given a report. Like the physician may read it and see it, or physicians or nursing staff, once they're transferred on the floor, may see that. And that does it for this section of infectious diseases. Just remember that, that one of the most important things we can do is proper hand washing. Make sure you utilize your PPE and BSI at all times, and make sure you communicate issues of concerns to providers that are going to be providing treatment to your patients. Our next step will be routes of disease transmission, and if you have any questions, as always, please make sure you give me a call. Thank you.